Although life expectancy of people with multiple sclerosis is not really different from the general population, they are still dying unlike the general one. For today's talk, we will focus on multiple sclerosis and how it affects one's life. But before that, let's have a brief review of the nervous system. Come on, let's see.
What's up, viewers? I'm Juan, and this is my best bud, Two. Like what Ella said, we will discuss nervous system. To start off with, nervous system is a complex collection of nerves and specialized cells that transmit signals between different parts of the body. It is indeed the body's electrical wiring. The system has two parts. First, the central nervous system, which is made up of brain, spinal cord, and nerves, and the peripheral nervous system, which consists of sensory neurons, ganglia, and nerves that connect to one another. These two systems work together to collect information from inside the body and from the outside. They will process the collected data and dispatch instructions, facilitating appropriate response. The brain is the final destination point of info. It is in charge of sorting and filing before sending commands. It is divided into different sections. Brainstem, or known as medulla oblongata, located between pons and spinal cord. Cerebrum, which forms the bulk of the brain. Cerebellum, which is located behind the cerebrum. Diencephalon, or known as the forebrainstem,
nervous system can suffer from a number of afflictions including Huntington's disease, Alzheimer's, and multiple sclerosis. Multiple sclerosis involves an immune-mediated process in which an abnormal response of the body's immune system is directed against the central nervous system.
The exact antigen or target that the immune cells are sensitized to attack remains unknown, which is why multiple sclerosis is considered by many experts to be immune-mediated disease, in which the body's immune system mistakenly attacks myelin in the central nervous system. How did it happen? The immune system T cells that pass from the bloodstream in the nervous system to attack myelin, the fatty substance that surrounds and insulates the nerve fibers, as well the nerve fibers themselves. The damaged myelin forms scar tissues or sclerosis, which where the disease name comes from. Any part of myelin or nerve fiber that was damaged or destroyed, nerve impulses traveling to and from brain and spinal cord are distorted and interrupted, produce a wide variety of symptoms. Some of the formulated causes is that researchers have been able to identify which immune cells are mounting the attack, some of the factors that cause them to attack, and some of the sites on the attacking cells that recept to attracted to the myelin to begin the destructive process. Some focuses that MS causes by means of genetic factors, environmental factors, infectious factors, and many others. Age. Multiple sclerosis can occur at any age, but most commonly affects people between the ages of 15 and 60. Sex. Women are about twice as likely as men are to develop multiple sclerosis. Family history. One of your parents or siblings has had multiple sclerosis. You are at a higher risk of developing the disease. Climate. Multiple sclerosis is far more common in countries with temperate climates, including southern Canada, northern United States, New Zealand, southeastern Australia, and Europe. Certain autoimmune diseases, you have a slightly higher risk of developing multiple sclerosis if you have thyroid disease, type 1 diabetes, or inflammatory bowel disease. There are four courses of multiple sclerosis. The relapsing remitting MS, or the RRMS, which is very common disease course. It is characterized by clearly defined attacks of worsening neurological function. These attacks are called relapses, are followed by partial or complete recovery periods or remission. The second course is a secondary progressive multiple sclerosis, or the SPMS. The name of this course comes from the fact that it follows after RRMS course. Most people who are initially diagnosed with RRMS will eventually transit to SPSM. Disease will begin to progress more steadily with or without relapses. The other course is primary progressive multiple sclerosis, or the PPMS. It is steadily worsening neurologic function from the beginning. There are no distinct relapses or remission. The last course is progressive relapsing multiple sclerosis, or the PRMS. It is the least common disease or course. It is steadily progressing from disease from the beginning and occasional exacerbations along the way. Disease continues without remissions.
Multiple sclerosis may be variable and unpredictable. Each person's symptoms can change or fluctuate over time.
Its symptoms includes numbness or weakness in one or more limbs that typically occurs in one side of your body at a time, or the legs and trunk, partial or complete loss of vision, usually in one eye at a time, often with pain during eye movement, double vision or blurring of vision, tingling or pain in parts of your body, electric shock sensations that occur with certain neck movements, especially bending the neck forward, tremor, lack of coordination or unsteady gait, slurred speech, fatigue, dizziness, problems with bowel and bladder function.
People with multiple sclerosis also may develop muscle stiffness or spasms, paralysis typical in the legs, problems with bladder, bowel or sexual function, mental changes such as forgetfulness or mood swings, depressions, and epilepsy. There are no specific tests for the multiple sclerosis. The diagnosis relies on ruling out other conditions that might produce similar signs and symptoms. While there is no definite blood test for multiple sclerosis, blood tests can rule out other conditions that cause symptoms similar to those multiple sclerosis, including Lyme diseases, a group of disease known as collagen vascular disease, certain rare hereditary disorders, and AIDS. Other tests are used to confirm the multiple sclerosis and are provided additional evidence as necessary.
First is magnetic resonance imaging, or the MRI. It is a diagnostic tool that currently offers the most sensitive, non-invasive way of imaging the brain, spinal cord, or other areas of the body. Evoked potentials, or the EP, is a test that measures the electrical activity of the brain, can able to detect the slowing of electrical caused by the demyelination. Demyelination of the peripheral nervous system, or the nerves outside the brain and spinal cord, occurs in Guillain-Barré syndrome. Although multiple sclerosis is the most common, there are other things that can damage the myelin sheath.
There is no cure for multiple sclerosis. Treatment typically focuses on speeding recovery from attacks, slowing the progression of the disease, and managing symptoms. There are treatments for attacks.
Corticosteroids, such as oral prednisone and intravenous methylprednisolone, are described to reduce nerve inflammation. Side effects may include insomnia, increased blood pressure, mood swings, and fluid retention and plasma exchange, or the plasmapheresis. The liquid portion of part of your blood is removed and separated from your blood cells. The blood cells are then mixed with a protein solution, or the albumin, and put back into your body. Plasma exchange may be used if your symptoms are severe and haven't responded to steroids.
No therapies have been shown benefit or slowing the progression of the primary progressive multiple sclerosis. For relapsing or remitting multiple sclerosis, certain medications can lower the relapse rate and reduce the rate for formation of new lesions, particularly early in the disease course.
The options include like beta interferons. These medications, which are injected under the skin or into muscle, can reduce the frequency and severity of relapses. Beta interferons can cause side effects such as flu-like symptoms and injection site reactions. You'll need blood tests to monitor your liver enzymes.
To help relieve the signs and symptoms of the multiple sclerosis, a physical therapy, muscle relaxants, medications to reduce fatigue, and other medications are prescribed for depression, pain, and bladder or bowel control problems that are associated with multiple sclerosis. Importantly, get plenty of rest, exercise, cool down, eat a balanced diet, and relieve stress. Living with any chronic illness can be difficult. To manage the stress of living with multiple sclerosis, consider these suggestions. Maintain normal daily activities as best as you can. Stay connected to friends and family. Continue to pursue hobbies and you enjoy and are able to do. Contact a support group for yourself or family members. Discuss your feelings and concerns about living with multiple sclerosis with your doctor or your counselor.